think we'll give it a few more minutes. Let some more folks join. All right, I think we could probably get started. Does that work for you, Jess and Pam? Great. Well, thanks everyone for joining. Just going over some quick housekeeping. We are in a webinar mode. So if you do have any questions or anything comes up during today's session, you can easily write your questions, comments in the chat box, or you can raise your hand and we will call on you and allow you to speak. And I think I'm going to turn it over to Jess to welcome.
Welcome, everyone. We're so glad that the members of our practitioner boards and stakeholder boards could join us. Sorry for the background noise between dogs and teenagers. A quiet spot is harder to come by during the pandemic than you would think. But thank you for taking the time. I know everyone is really busy. We have updates both on sort of translation and product development for our practitioners, and some content to go over that Pam will lead us through. So anything else, Pam, in terms of a welcome?
Nope, go ahead. Take it away.
And Tisha, did you want to say a few words to both of our boards before we get started?
Sure. I just want to welcome everyone. Thank you so much for participating in the steering committee. We really value your input and feedback. And so I'm just going to sit back and listen. My job here today is just to be a listener and a learner from you all. And I'm excited because I think that the ideas that you've brought to us are things that we are trying to identify paths forward on. You've brought up really important issues. And so I just feel privileged to be able to listen and hear what you all have to say. So welcome and thank you.
Great. And Braden, did you want to go over any Zoom housekeeping?
Sure. Just a reminder, if you just hopped on the webinar, everyone's in a listen only mode right now, but if you do have any questions or comments, you can write that in the chat box on the bar on the bottom of your screen, or you can raise your hand and we will call on you, allow you to answer your question live.
Great. I think we have a little bit of time here on just the DSE, the Dissemination and Stakeholder Engagement Core overview and focus. So as most of you know, you all are a part of an effort for us to really build the dissemination network that we envision to make sure that the research and data coming out of JCOIN and the studies gets into the hands of practitioners and individuals like each of you who do this work every day. What comes with that is us learning and listening and translating sort of research findings, but also figuring out what formats and information is the most useful to you all as practitioners and key stakeholders. This update today will give you a little bit of a sense of where we are and some of the products that have been developed. And also we can dig into some other topics that we want to drill down into and get more information out to each of you as a result of meetings like this. Pam, anything else on the overview or the scope of DSE?
No, thank you, Jess. I think we just want to dive into it. The second half of this session will be as an outgrowth of some of these previous conversations. So it's real important for us to hear from everybody on this regarding their interest, the questions they have, etc. We take them seriously and we do follow up. So we appreciate your time and attention.
So I'll jump right in. So the vision of JCOIN is to ensure that every justice-involved individual with an SUD has access to evidence-based treatment. Next slide. This is a quick overview, which looks a little overwhelming, but as we start to translate and get materials and resources to the field, and looking at both justice and health fields together, we identified 20 distinct audiences that you all represent. So we broke it down here between criminal justice, health systems, community services, and state and local government, and sort of honed in on this. And also want to understand sort of the unique formats or needs or challenges or barriers that each of you all in these distinct lanes have. So making sure we're tailoring our content, our knowledge dissemination, research translation to everyone who has an important role to play in how we respond to individuals with addiction in the criminal justice system. Next slide. So just a quick overview of some of the pieces that we've developed. So as a starting point to sort of explain the aim and the purpose of JCOIN, we developed a quick explainer video that just went through the aim and the mission. So Braden, did you want to play this for everyone in case they haven't seen it, just as an example of our research or our project translation products?
Absolutely.
So some helpful feedback from our practitioners after releasing this is narration would be helpful for those that are auditory learners. So we're working on finding the right narrator to attach to all of our explainer pieces. Our next items in the works on the explainer video side is a little bit more on JCOIN about the hubs and the studies that are underway, a little bit on you all on our project and the CTC to engage practitioners and key stakeholders. And then also some of the key pieces. We're doing one right now. I think I'm about to send it to Tisha, or it's on its way, explaining the risk of individuals with a substance use disorder during reentry to the community, particularly if they have an opioid use disorder. And also doing a piece on explaining the gap between clinical research and practice, and sort of the role of JCOIN in closing that gap, and the role that each of you will play in that. And as you have topics or issues that are of interest or a challenge or are keeping you up at night, please let us know so that we can figure out how we can best connect information, whether it's a research summary on the topic, it can be drilled down to a video explainer, we need to do a more in-depth brief. We're trying to build content that's responsive to your needs. Next slide. So on the research summaries, the first one that we put out was on overdose risk during reentry, and some of the key takeaways, and also highlighting key research that can be helpful to you, whether you're making the case for funding in your jurisdiction, you're doing a training of staff, that you're working with other folks, you're writing testimony, submitting publications. So clarifying and putting the research in a easy to sort of consume brief, that individuals leaving incarceration are 129 times more likely to die of a drug overdose than the general population, and having some of those easy to pull citations and research ready for you. We have others that are in the works on medications for opioid use disorder, MOUD, and as topics come up, such as the R&R and ASAM criteria topic later this session, we'll make sure that we're putting those out in formats that are useful. Next slide. So the other key component of this that we're really excited about is to work with you all to get this information that is responsive to the needs of your field or your organization out to you. So we have our first webinar, JCOIN webinar, in partnership with Correctional Leaders Association, CLA. I want to thank Kevin Kemp for sort of hosting and being our first partner to kick off our webinar series. And we can follow these up with online courses or other content that meets the needs when it comes to this topic of SUD and criminal justice. I also want to thank Nelson Bunn with National District Attorneys Association. We're planning a series of webinars and courses on topics from reentry planning and MOUD to cascade of care, person first language, and other topics that are of interest. Elizabeth Pike with NCJ is also working with us on a webinar series for her members, and really grateful to everyone who is working with us. It's sort of our test kitchen phase right now as we figure out how to get these up and running. These really will be built based on the topics that are really a focus in your memberships, but we can be responsive there, and then making sure that we're bringing in key researchers and others that can get feedback. I'm really glad that Tisha is joining us for our first webinar in October with CLA. And you will soon get an email from us detailing some of the topics that we're ready to go on, and seeing if your organizations are interested in partnering on a webinar or a webinar series with access to online courses as well. This will be a focus of ours over the next couple of years to really make sure we're building those pathways to respond to the information that your stakeholders, that your members need, and that we're ready to disseminate findings and data as they become available out of JCOIN. Next slide. So we thought we would have a little discussion today and take a bit of time instead of, we ran through a few samples, but to just learn of product types that are of interest to you, whether it's research summaries or policy briefs or more explainer videos. If there are particular topics that you want us to dig into, or are looking for sources of information or support, we would love to push pause on running through slides and just have a dialogue about that. And I guess we do that through the chat function, right, Braden?
Late 80s for some of these. As cloud computing technology,
we can start unmuting folks. If anyone has any comments or wants to speak, if you can either press the raise hand button, I'll unmute you.
Those folks are familiar with,
or you can write in the chat too, and we'll do the same.
Now you can handle much larger data sets. That's the first thing, and then
can you mute Faye? I think we might be getting some feed. Faye, we might be getting your sound from your other meeting.
Much more than you ever.
I hear Phil. Thank you.
Thanks, sorry. Now, I was just gonna say, since we don't have 100 people on here, can we undo this, Cameron? Just so people can freely talk?
Yeah, we can unmute everyone. We'll go through that right now.
Yeah, I mean, I just make it, more dynamic. A couple of people also wanted to put on their, video, so, we can engage a little bit more, so.
I'm not sure if we can do the video part, but I think we can do the unmute part.
Okay. And then there are, in the question and answer, there's actually 2 questions already. So one is, Tom wants to know whether or not we're going to do CME credit eligible courses. So Jess, you want to answer that first?
We can. We do have some mechanisms and folks we can partner with to and sort of set these up for CME credit. That's an interest to folks. Tom, do you have is there a certain set of organizations, or if you want to set up a call for us to talk through who we should be coordinating to make that available to their memberships, I think it's a great idea, especially if there's a need.
Yeah, so we had arranged, actually, University of Massachusetts at Worcester has that built in for social workers and nurses, and I think for MDs. So we probably just need to get a list of what sort of CU credits. I don't think we have any law credit, but that might be useful for judges and lawyers too, for us to pursue.
Faye, this is Warren. That's not quite accurate.
Oh, sorry.
We have the capacity to do it, and we have a small budget for that. We have not yet applied for credit, and we have not necessarily mapped what it is that we are trying to provide credits for.
Yeah, so I think if we could find out what people's interests are, Jess, we could work with Warren and others. But we have funds, we should have funds through the CTC to be able to facilitate that.
We also,
especially since we're moving on so many things online, because there's less of a, because of the restrictions on travel right now. So.
And I can let me just very, very, very briefly speak to that point. So a number of our products will be available for asynchronous viewing. What I've learned as I've done a deep dive into CME land is that if people are viewing things asynchronously, typically it qualifies for Category 2 credit, which is a little different than for other live presentations. We do have a capacity to sign up for, apply for and get continuing education credits for the disciplines that Faye noted for live presentations. So, for example, if this was, if for the current conference, if we had applied for credits, we probably would have gotten some that would have qualified. I'm not sure the entire meeting would have qualified. It's actually a little tricky overall.
Yeah, I mean, there's requirements, but we'll go ahead and pursue that.
And we also at Addiction Policy Forum have a partner that can set up CME credits for online courses.
Great.
Great. We also had a question on if we've considered partnering with state SUD licensure certification agencies for CEUs. Pam was going to respond to that one.
Oh, Pam is? No, I would say the answer is the same thing as Jess gave. The state-by-state partnering is a little more challenging, but given the partnership that she has with an organization that helps facilitate this, it is definitely something that we're considering as an incentive for folks to take the courses, et cetera. So we're very interested in doing that. And the logistics are just something we have to figure out.
Another question for the team here. Someone mentioned CLE credits. Is there interest, need to sort of explore credits for our district attorneys, our lawyers, defenders, judges through our JTech project as well, our online learning? I don't really see.
I mean, Jess, I think we could just send out a quick survey instead of trying to do that here to see which ones would be relevant, given our time limits. There's also another question by Ed in the Q&A where he would like us to comment on the current research that was in the article, The Perfect Storm of COVID, Mass Incarceration, and Opioid Epidemics. And I'm wondering, Ed, if you wanted that as one of the research translation projects that Jess was talking about?
Yeah, thank you. I think it would be nice to have something like InfoStats so that the stakeholders could see what's going on in real time, get the data right there so that they can see in their own state or nationally what's happening in terms of COVID and opiate overdose within the incarcerated population. I think that would be helpful to people both in evaluating the work that we're doing and seeing, if we've made any dent in it or mitigated it, and also research on best practices would be really important. So I guess, we would be the recipient of some team that's gathering this research. I think they're doing it in a lot of different fields, but I think this would be an important area to have that level of data in people's hands before it would be part of research, but it's also more epidemiology as well.
And I just want to add in response to,
Yes, go ahead.
I was just saying in response to that, we don't have, one thing we don't have with the way we've structured JCOIN is we don't have sort of real-time epidemiology. We do have another HEAL project called the Healing Communities Study in 4 states where they're trying to work, and I see Dana Bernson is on the phone, and she's involved in that as well, and they're trying to work with the states to deliver a little bit more of a real-time view of that. But we do have several folks, so I guess just to say, I want to acknowledge the limits of what we have that we can do, but we do have several of our investigators within the JCOIN network who are clinicians who are working on the front lines. They're seeing lots, they're making a lot of important observations and publishing. The paper you shared that you mentioned specifically was written by Nabila El-Basil and one of her trainees. And Nabila is actually part of the Healing Communities Study, but we do have several other articles where members of the JCOIN network and investigators have written some articles about sort of what they're seeing and what those trends are, and pulling that together. And one thing I think that maybe would be responsive to the observation you're making here is just thinking about how do we pull together some of that kind of literature and share it with you, even if it's not directly the JCOIN studies themselves. Am I understanding the need you're expressing here correctly?
I think you're very good with the addition of best practices. Try to get this out into the field more quickly because of the impact of these 2 epidemics on the incarcerated population.
Great. Thank you for sharing that perspective.
Thank you for bringing it up.
We are collecting sort of sites and locations that are innovating during the pandemic. And we'll have a series of articles and features that sort of highlight your work from many of the folks that are on this call that have, whether it's getting creative on MAT access, take-home doses, it's telehealth expansion, both sort of inside facilities or outside. So that is something we'll be sharing, and we are on an ongoing basis collecting some of those best practices and innovations that we can put out there and put on the JCOIN website as well.
Can I just add one thing would be to have data on ethnicity and race in anything that we present, to really require it.
Absolutely.
Thank you.
So we have a question from Lori Crom that someone else has reiterated in the Q&A. I'll take a first stab at that, but actually, maybe Lori, do you want to actually say your question out loud? I want this to be a discussion.
Sure, can you hear me okay?
We can.
I'm just wondering, it came to me as you were talking about what webinars you might be producing, and it seems like there's a potential for some collaboration or synergy between the webinars that you have planned and webinars and other online activities that I've seen from other sources like BJA's work, and also some of the many SAMHSA TTA centers. I know through the Opioid Response Network, we had a conference in January on mood in correctional settings, MOUD in correctional settings, and we're about to post a whole series of videos that were captured during the conference. And I know National Council has their toolkit on how to integrate MOUD in correctional settings. So it just feels like, maybe it's just me, maybe it's just myself, but I'd love to see kind of a map of all of the things that are available and some kind of outline for who's doing what, so that we're not all trying to do the same thing, if that makes sense.
That's really helpful, Lori. I can tell you, we have reached out in the past to the Opioid Response Network, and I know that I believe Rose Martin was one of the presenters at that
Yes.
conference in January. So we have some overlap, but I think, and COSAP, BJA is funding quite a large supplement that funds a lot of the kinds of activities we're doing here. But I think your observation here is a really good reminder for us that we need to keep working at those relationships and figure out sort of how to make sure that everything we're doing is complementary. But let me also go to Jess and Pam and Faye, and they can share their thoughts as well. But we have reached out to those groups, but we have not necessarily done all of the steps that you're taught that I think are really important that you're highlighting around making sure that our efforts are complementary.
So I'll take a first run at it and let Faye and Jessica get off mute. Absolutely, we are both on the sending end and the receiving end, as you know, Lori. I'm sure you're in the same boat as are many. We see a lot of offerings come across our inboxes, and everybody is moving from in-person meetings to conferences, et cetera. And so we are not just looking at what other people are offering, et cetera, but we are also looking at sort of cross fertilizing and really with a goal of disseminating all of the best work that is out there to our network and to other networks. And so if you go back to it's not a spider web, whatever that design was that Jess put up there. I can't remember what we call it. And if you could see closely, you would see that there are a lot of different lanes in there and a lot of different stakeholders. And so our goal in listing the stakeholders is to ensure that we're communicating with them, talking with them about the kinds of materials that they're interested in, and customizing whatever offerings we have to them that are not redundant, duplicative, or anything else, but that meet their interests of their lanes. So we'll take a core presentation and customize it to our audiences. And part of that includes tapping into all the other resources that are out there in the space, in the very broad space of SUD and criminal justice. Jess?
Absolutely. I mean, the goal is to not be duplicative, but to fill in the gaps, to make sure we're being responsive. But the other thing that I think is important that JCOIN adds is to make sure we're bringing in researchers on that topic. So it's sort of a marriage in a way of the practitioners, the key topics that you want to dig into, but working with Tisha and Nida on which researchers on these topics we can really engage for sort of latest updates, but then also to connect them to you so they know what's promising. I'm seeing a comment and question from Elizabeth Pike at NCJA. What are the promising practices that you're seeing in your among your members? What are the key challenges in making sure the researchers and practitioners are able to engage?
So the one thing I also wanted to point out is, the emphasis of a lot of work, both that Pam and Jess are doing, but also Warren and Danielle in the LEAP curriculum, is really to bring, to really bring more of the research findings in, with an emphasis on looking at some of the implementation issues, because we have a great interest here in really trying to think about how to implement the research findings in real world settings, which means we have to begin to think about some of the implementation issues. So I think, we're hoping that the courses that are being developed here in response to the needs of the field will be, more I don't, with no disrespect to anything, you know, some of the great webinars that have been going on, but really a deeper dive into what does this mean and how do we really implement some of these issues. And I think that's the challenge that we want to take on as part of JCOIN. And that's why, as Jess was talking about the work with, you know, the Correctional Leaders Association, you know, it's going to start out with webinars, but it's going to be piggybacked with some educational materials that could then be used by your organizations or correctional organizations. Same thing with the prosecutors, so that we're really trying to, you know, do a deeper reach, but also work on building people's knowledge and skills about what some of this research is.
I can piggyback on that, Faye. I think that answers or gets to a question that Elizabeth raised in the Q&A, and that is how do we dig into that lower level of detail and implementation. And I'm glad you reminded everybody that we're starting with webinars, in part as a listening tour, as it were, so that we can get to the very specific interests of the different audiences that we're talking to and learning from. The other thing I want to just remind everybody is that some redundancy in communication is necessary, and some redundancy in education is necessary. So even though it might feel like there's repetition, et cetera, we also know that that tends to be necessary, and that different messengers resonate with different audiences. And so part of what Faye is doing in the CTC is also evaluating the effectiveness of the communications that are coming out as a result of some of the work that's being done. So we're not just, you know, blanketing the universe with a whole bunch of stuff, but we are also trying to figure out what are the better messengers and the better means by which this information sticks with the audiences that we're targeting.
Pam, I just want to say one thing, and then I know Elizabeth had her hand up and had more on her question. You know, I want to thank all of you for helping us think through this too. JCOIN has given us an opportunity to bring infrastructure that we haven't had before. We've, I think traditionally, even in our large initiatives that NIDA has funded in the justice space, we've just done the research and not thought about sort of the push and pull between research and practice and policy. And I think that, you know, we're seeing with COVID, like these things move very fast, the sudden shift to telehealth. And we're trying to figure out how to get all of the pieces that we have for JCOIN to how to build them in a way that's going to work and fill gaps faster than we've been able to do before. So I just want to express my gratitude to all of you for helping us sort of see the issues, to think through the tools we have and the tools we need so we can figure out how to get it all to work together. But I want to acknowledge, you know, we're sort of building it as we go, and we're trying to be responsive to the things that emerge. So, you know, thank you for helping us figure it out. I don't know if Elizabeth, you had a question several minutes ago and had your hand up. I don't know if if we've strayed from your question or if we should go back to that.
No, this is actually really helpful, Tisha. I think what I struggle with on these calls, and just we had a conversation with Jess and Braden the other day about the webinar that we're planning, and we want it to be a series. And I've really struggled with how to do that, how to bring it down to the very practical, hands-on program and practice kinds of examples that I believe our members at NCJA need to have. But it strikes me that, I mean, I love that chart that you had earlier, the spoken wheel. I think that is incredibly helpful to just envision the system and the different partners that we all can be focusing on or thinking about as we're working with our audiences. And one thing that just strikes me listening to you guys right now is that it would be helpful to me, I think, to think of themes. Like one thing that occurred to me is our members do strategic planning. So they're thinking about different intercept points. So maybe we do, you know, a webinar of promising practices at the intercept points, or maybe we are focusing on women in the justice system, or maybe we're focusing on, you know, some other topic, but maybe we can, it would help my brain that is sort of pinging around all of this to try and bring it down to manageable bites, but perhaps within themes or directed at audiences, or it's hard for me in my world to think, oh, this is a need that we have. Let's go talk to researchers and figure out what the research says. It's easier for me to hear what are those things sitting there on the window shelf that we could pick up and translate to our folks.
That's really great feedback, Elizabeth. Thank you.
And again, I say this chart is incredibly helpful. If you will let us have it, we will use it, just as in our planning work with our members and just in our thinking about trainings and policy and practice, to just, you know, have this huge world right there in people's minds.
Absolutely. We'll send the slide out. I call it the robot octopus, but that's just...
It is. Yeah, there's some visual about it, I agree.
A little strange looking, but we've condensed to 20 audiences from 20. So it's a little simpler than it was 2 months ago, but it's all critical for the work that you all do. And you could just as easily put your members, Elizabeth, in that middle of that donut hole. And these are all the services and lanes that your members are trying to coordinate with state by state too.
Well, and if you can, you know, talk about themes, if you can, you know, so I think about the state agencies. So how do our state agencies work with their corrections or work with community corrections? You can go through each of those robot arms and think about what are some promising practices that you can do in partnership with each of those different stakeholder groups. That would be a helpful theme too.
This is Sis. Can you hear me?
Yes. Hey, Sis.
I can hear you and see you, but I don't know. I didn't know whether I was in or out. I've been trying to get in for a while. I would like to say ditto to what was just said about this graphic. As soon as I saw that, I thought I would love to have that and talk to people in the communities on how they could pay attention to the neglected population. That's the children of all these people we're talking about. And it seems to me that we could add into some of our research work examples of where we're doing what we're doing, and then where we're also doing it for the with the children involved. We have a lot of programs in drug courts all across the country that are whole family recovery programs celebrating families, and they make a huge difference in outcomes because the whole family starts getting better, not just the one person who is in trouble with the justice system. So maybe you're going to give us all these slides, and that would be wonderful, but this one is especially good for what I'm trying to do. And this week we're doing one of these flips of what are you going to do? Everyone said, well, you can't do anything because the children aren't in school. You can't do anything because they can't leave the house. Well, we've been training all this week, all our trainers to train people to do our programs virtually. And we have already tested it in California and it actually had better outcomes. It was a little embarrassing than some of the in-person ones did. But I don't see anything in what I'm hearing and what I'm looking at that says who's missing, and the people who are missing are the children who are tomorrow's people with mental health or people who with addiction because they didn't get help when they were children. So that's my 2 cents. And I want your chart.
Well, we will get you the chart, and thank you, Sis. I'll add that to the growing list of themes that I'm jotting down. I think we also had Deanna with her hand up.
Yes. Hey, Jessica. Hey, everyone. And this is kind of redundant, and I know it makes sense to us on this call when we list community services, peer-based services impacted, and I see myself in several of those. but directly impacted from the criminal justice system has always excluded themselves when you start talking from a community perspective, although it kind of goes together. And I'm wondering if we should highlight that when we're sharing this wheel, that people with that criminal justice experience who also has the recovery experience are stakeholders as well, and very key to this. I don't know where we kind of make that distinction, but I just know from interacting with the criminal justice, individuals impacted by the criminal justice, they always exclude themselves when people talk peer-based from the community.
Okay, that's really great feedback. We were sort of between reform advocates and peer-based services and those impacted, sort of one of the arms off of the red left side of the wheel. But if we should have a separate lane that more specifically includes individuals with lived experience, if they don't see themselves in those categories, I'd love to get on the phone with you and make sure we get that right.
Yeah, because I see myself, but everyone's not a reform advocate when you start talking about
peer
from a community perspective. Yeah, so I just wanted to bring that up, that we deliberately be inclusive.
Love that. Thank you, Deanna.
So Jess,
I think that's great. That's a really great point.
So Jess, I think what Sis and Deanna were talking about is really, we need another spoke for people who are directly impacted, whether it be families, people with lived experience, or people, you know, who are in recovery, or people who are active users, or people in different stages of the justice system.
Yeah, I love that. I love my infographics, so I will tinker with this and have a different formulation, and I'll run it by Deanna and Sis before I report back. Does that work for you, Deanna and Sis?
Yes.
Could we tie Carolyn Harden's question into this thread here? Carolyn, you want to ask your question that you've typed in the Q&A?
Sure. I was just asking about peer recovery and recovery capital. Those are two big things that we're seeing a lot more in drug courts and treatment courts, and then working with community supervision, really trying to help people to understand what we mean by recovery capital, helping them to build program around it, and just hoping that there is more research in this area, especially as it relates to peer support. And if there is, how can we get that out to our people?
That's great feedback. Can I do a quick? Oh, I'm sorry. Who was that speaking?
This is Liz Burden. I've had my hand up and didn't know if I got mixed in with the other Elizabeth or something and didn't get noted. But it relates to everything that's been said about, including the previous question, and kind of circles back to the comment that Lori made in many respects. So I appreciate all the previous questions and comments. I would think that one of the ways to get out more about recovery capital research, as well as the implementation science pieces that Faye talked about, really is looking at deepening the partnerships and being intentional about partnerships with folks like the Opioid Response Network, the GAIN Center, the BJA, COSAP, PTA providers, around webinars and other self-directed learning or learning community courses or offerings and the like. Because I do think that all of those entities are looking at ways of making research practical, even if they don't talk about necessarily the research within their webinars, that they're based on the research as well as promising approaches and implementation science and the like. And I think that as one of those providers in the peer recovery support space, we could really use the partnership with researchers. And I can envision series that say, let's start with part one, what does the research say? Part two, what's from theory to practice? And part three, let's talk to a practitioner that's put some of this theory into practice to see how it works. And so I just encourage you to really think deeply about some intentional partnerships in that space that I think will serve this whole wheel better, including on recovery capital. We've done a lot of digging in the project that I work on the research around recovery capital. Know there's a lot more research to be done, but would love to be partnering on those kinds of initiatives. Thanks.
Absolutely. Thank you. That's great feedback. We'll reach out to figure out next steps on those partnerships.
And I just wanted to make 2 comments. First, to Carolyn's point about the peer navigators and linkage facilitators, we actually have a work group in JCOIN, because Tisha, correct me if I have the wrong number, but I think there are 6 or 7 studies that are actually using peer navigators as part of their study protocol. And we have a very active work group that perhaps at some meeting we could invite some representative from that work group to meet with this group. But they're doing a lot of work, to Carolyn's point, about really trying to develop training materials, quality assessment, assurance materials, issues related to effective practices. But it's a very active work group. So, I wanted to make people aware of that. And then to Liz's point, I think that, part of what the dialogue today is, and I know NIDA is very interested in this, is really, what are some of your ideas about research projects that would be very beneficial to the field? And really, we've set up the dissemination and stakeholder group to get a feedback to the researchers about, what do you think are missing in the current set of studies that we currently have available? So I encourage people to think about some of those and let us know, obviously not just today, but at any time, because this is something that will benefit us, but it's also something that I know that Tisha is passionate about. Not to speak for her, but.
Yeah, I mean, I would just say, I think for me, part of the idea and passion that drives why I think this group and all of your feedback is so essential to JCOIN is I saw lots of silos. I had a close colleague at BJA, and I would go to the BJA, and at SAMHSA, I would go to their meetings, and the conversations were so disconnected from some of the conversations that were happening at the research meetings. So for me, the whole vision of JCOIN is about trying to break down those silos so that we hear the questions sooner, we can do the research faster, we can share the insights from those research, we can bring lots of tools to bear. So, I think part of this exercise is helping us understand what it is you need, and then how do we connect the dots from the research. So just to Faye's point, kind of the big picture that what we're trying to do here, but I think that there are lots of challenges, but I'm really hopeful that we can overcome them. And I think the space of peer navigators and linkage facilitators and recovery capital, I think that the research is underdeveloped, and we can help develop that by listening to the field. So just in response to Faye's point there, but there are so many questions. I want to get to all of them. I don't even know where to start because there's such a rich discussion right now. So I see that if I look at the participants list, I saw that Judge Sloan has had his hand up, and I know it's hard if you've got your hand up to get in on the conversation. So maybe we can go to Judge Sloan, and then I'm overwhelmed with the chat and excited. So I'll let the CTC team figure that out for us. Yes.
Yeah. So Judge Sloan, can we hear from you first, and then I'll run through some notes that I have from trying to keep up with everyone in 2 separate chats. I was ignoring one for a while. I apologize for that. But Judge Sloan?
Sure, thanks. So maybe piggybacking in part on some issues raised, at least they did in my mind, but I'm wondering where the population that is involved in juvenile justice is included as a stakeholder. And by juvenile justice, I mean what are referred to as dependent and neglected children cases that will, of course, involve their adult parents. And then juvenile justice, meaning someone under 18 years of age, basically charged with a crime. are we including them in the children, family and children's services bucket, or is it intentionally left out?
Sorry, real quick. Chad Samora, I was a prosecutor. Those, and I worked in abuse and neglect. I think 80% of those abuse and neglect cases actually started. So we have a clear indicator there too, just to throw that out there as a pattern. Now, obviously, at that age, when you're in child support enforcement, an intervention is not likely. However, we have an identifiable pool of population that is more likely than not headed towards abuse and neglect or juvenile delinquency.
So you all are touching on an issue that is super near and dear to my heart. One thing I can tell you, we do have one juvenile justice focused JCOIN project, but we also, there was a HEAL prevention project that was part of the overall opioid initiative. They have two projects that are in the juvenile justice space. You'll hear, if you join this afternoon, you'll get to hear about those projects, and we have some crosstalks, so we keep that. And, you know, I started my career in child welfare. The project that I worked on right before this and led for NIDA was juvenile justice focused. And I'll share with you all something I don't always share, but my father was incarcerated for much of my early childhood. So this is really a big issue for me, and something that I hope we can grow the network in. So thank you for picking that up. We should make sure that it's represented on this wheel, but I want to assure you that this is definitely a priority area from my perspective.
Yeah, I will follow up with you, Judge Sloan and Chad, as well as Sis Deanna and Lori. I think we're looking at adding a spoke here, or a piece of the pie on those directly impacted. I think we might sort of have a little bit of a discussion on maybe adding the juvenile justice and the criminal justice piece, and then really digging in to make sure that we're not missing any impacted populations. So we'll work on a revision of this and get back to everyone. We'll share the slide as it is on your screen today, but then we'll also send you the revised slide once we have more feedback from you all.
Thank you.
In terms of other themes, just to do a quick recap, I think I'm coming up on my 3-minute before my end of our beginning session is over. So I want to make sure I'm not missing anything. In terms of themes and items, whether it's for webinars or sort of further digging into, we have the MOUD and corrections, reentry planning, understanding cascade of care, many comments on implementation science and making that sort of accessible and a dialogue with both justice and health practitioners. I think we have Linda Hurley put this in the chat about practical considerations, financial and political, that if you do have the research and you do understand implementation, how do you fund and find political will, that there are other pieces to this puzzle. Peer recovery, linkage facilitators, recovery capital, also topics to dig into. And then a little bit on best practices and sort of understanding what innovations that each of you as stakeholders are identifying. We also had the recommendation to really work on partnering with other providers, whether it's COSAP or GAINS, so we understand who's doing what. And another recommendation to even sort of help build a map of all the things that are currently out there, to make it easier for practitioners and stakeholders to navigate what's here and what's useful to them. Dan also had a comment about helping to clarify the certifications that are recommended by certain positions that his department is hiring, I believe for their diversion program. That's also really great feedback. And then we had another series of suggestions about digging in on how practitioners and researchers can partner and be successful. Did I do an okay job of distilling both of these lists?
Yes, and I want everyone to know we are capturing your chats. I think we are able to export it, so we won't. Thank you for putting your comments in the chat and in the Q&A. We won't lose them if we didn't voice them, but I really want to thank you for all of the information you're sharing. This is super valuable.
Yes, very, very helpful. We'll circulate the list, and so we'll make sure that we didn't miss anyone. And for a few folks that weren't able to join us, we'll make sure that we incorporate their feedback as well to have a growing list of themes and topics that we are prioritizing for work and products for you all, including the webinars and online courses that we're developing. Anything else remaining before I hand it over to Pam? Anything that I missed, Faye?
No, I think we got a lot of good feedback and we appreciate it. I guess I do want to do one little other kind of preview of something that will be coming up in the spring. So with the support of the Bureau of Justice Assistance, which provided funds to NIDA, which then, asked the CTC to develop, we are developing a database that actually will allow each practitioner, stakeholder to register and put in your areas of expertise so we can do more of a connection app or dating app type of style, so that we can get out to the field who people can talk with in different fields, since we cover so many different areas here. So that's something to look forward to, and we'll be asking everyone to register for that. So that's it. Thank you.
Thanks, Faye. Thank you for all this incredible feedback. We will distill all of this and get some updated themes and a slide on mapping our stakeholder lanes out to everyone shortly. And Pam, hand it over to you.
Okay. I think I'm going to give you a 2-minute, 3-minute stretch break. And we are scheduled to start at the top of the hour with a session that grew out of a discussion that the practitioners and the practitioner board had with Dr. Volkov. I say that to you to indicate, and you will learn more and hear more about that later, but I say that to let you know that we do pay attention to what you say, and we do try to be responsive and in fact give you what you're asking for and what you say you need. So if you need to take a 3-minute break, stand up and stretch a minute and Zoom exhale. I know yesterday Cameron had nice quiet calming music playing on some of these. I don't know that we have a music background to give you a breather in, but that'll give us a chance to get our materials ready and our presenters to get oriented. We had and we're all here, so couple of minutes and we'll be ready to go. Somebody want to pull up the beginning slide for the next presentation for us? Okay, Glenn, I saw you're here. Are you ready? If I
yeah, I'm here.
Okay,
I'm here.
super. All right. I hope you all, I don't know, grabbed some water and stretched a little. We have the second half of this session is focused on assessment tools in the criminal justice system, really looking at, concretely looking at ASAM and R&R principles and how they work together and how they could work together better. And this is a session that grew out of some discussions that we had, as I indicated, with Dr. Volkoff and our practitioner board. The presenters this morning, or for me it's morning, for some of you it is now afternoon, are Glenn Tapia from the state of Colorado and Heather Taranja from GMU. And we will leave time again for discussion and questions and answers and things like that at the end. And our goal is to have the presentations done within 30 minutes and then move to about 25 or 30 minutes of Q&A. So Glenn, thank you for kicking this off for us.
Yeah, you bet. Thanks everybody for spending some time today. Just as a practical matter, Lindsay's going to be driving the PowerPoint for us today, and so you'll probably hear me ask her to click through the slides. It's just easier that way, so just forgive us if we have to do a little bit of awkward clicking instruction as we go through the presentation. I'm going to be speaking today somewhat conceptually about an idea that we've talked about integrating and maybe bridging a divide between the Risk-Needs-Responsivity framework and the ASAM criteria. Lindsay, if you can go to the next slide, that's great. And one of the things I just want to put on the table is that I believe, and I think a lot of us here would believe, that both crime and addiction and other habits that we have as human beings are biopsychosocial disorders or biopsychosocial problems. And what I mean by that is, if you're not familiar with the term, there's a biological component, and that kind of lives in our genetics, in our brain, for example. There's the psychological component, which is kind of our emotions and our cognitive behavioral status, those types of things. And then there's the environmental focus, the social component, which is extrinsic. That's the kind of nurture part of the nature-nurture idea. And so I believe that both crime and addiction are biopsychosocial disorders. Before we talk about that, I want to talk a little bit about this concept of a cardiogenic need. And I need you to use your imagination a little bit here and try not to think for a second about the justice system or people involved in the justice system. Think of yourself as we talk about this word cardiogenic. And where this comes from is essentially a facsimile of a term in the justice space that we use called criminogenic. And so what cardiogenic means for today's purposes is the likelihood that we have problems that could contribute to our risk of having heart disease, heart failure, or even death from heart problems. And the science would tell us that there are both static and dynamic factors that contribute to our cardiogenic risks and our cardiogenic needs. The static stuff that you can see on the screen are things we can't really control. Those things typically just get more indicated or sometimes, quote, worse, and we don't have a lot of control over those things. What we do have control over there, if we're trying to mitigate our cardiogenic risks and needs, are the things that we can change, and those are the dynamic factors that you can see on the screen. So our habits fall into those, our genetics fall into those, what we eat, what we do, all those things contribute to our level of risk and the needs that we have to moderate our risk for having cardiogenic problems. There's also another aspect of things that don't necessarily predict risks or needs, but that can get in the way of risks or needs. Next slide, please. And those are things like motivation, mental illness, even our financial state. Those kinds of things in and of themselves don't predict cardiogenic problems, but they do get in the way of addressing some of the needs that we have in order to reduce or moderate our risks of having heart failure or heart disease. In the justice space, we call those responsivity factors that in and of themselves don't predict risk, but if left unaddressed, they can not really create an optimal learning environment or a skill building environment for people to change behavior to address their needs. Next slide, please. And so the way I think about it sometimes is when you heard Tisha Wiley talk about silos and breaking down silos, I believe that the Risk-Needs-Responsivity framework and ASAM are in two different silos that we have an opportunity to break down. And so I'm going to talk about those in small scale for just a second. Next slide, please. When we're talking about risk needs responsivity, for those who aren't familiar with the term, generally speaking, sometimes risk is misunderstood. Sometimes people think that risk means the likelihood of a person being dangerous or the likelihood of somebody committing a felony versus a misdemeanor, for example. That's not what we mean by risk. Risk simply means the probability of further justice involvement. It really just means that. When we think of a person who's at high risk of further justice involvement, it does not mean dangerousness or violence potential or anything like that. It just means they have a lot of needs, next click please, that contribute to their level of risk. Those are the things that you see on the screen, and not all needs are created equal. I'm not going to go into those in elaborate detail, but those are all biopsychosocial needs that contribute to a person's risk of further justice involvement. And then there's plenty of responsivity factors that, if left unaddressed, can get in the way of addressing needs, which, if left unaddressed, can compromise our ability to reduce risk of further justice involvement. ASAM looks at things a little bit differently in the fact that it really kind of focuses on substance use. Again, another biopsychosocial disorder, and ASAM has these kind of 6 general domains about how to treat people with substance use involvement. And so what I would like to argue for today is a little bit of a more proximal relationship between the risk needs responsivity frameworks and American Society for Addiction Medicine. Next slide, please. So I want to tell you a quick story about why I believe this, and there's more to this story, but in Colorado, we have this annual conference. It's about 900 people, and it's called our Collaborative Justice Conference. And the conference is intended to break down the silos between justice and behavioral health. And so we have all the justice practitioners from around the state and all the behavioral health people from around the state, about 900 people for a giant conference that we do every year. And the whole idea is to collaborate and learn from each other's research bases. So I'm at this conference in 2013, and I'm listening to a justice practitioner talk. She was a PhD criminologist, and I was listening to her talk along with some other people. And a question came up in the room about risk needs responsivity, and the question was, is there really research on responsivity, or what's this really about? And the presenter said, well, there's really good research on the risk principle. There's really good research on the needs principle. But right now, the responsivity principle is not evidence-based, it's theory-based, and there's more research that needs to be done to really validate that principle. And I said, what? Because right down the hallway in this exact same conference, there's a whole bunch of people from the behavioral health community bored out of their mind listening to more presentations about trauma-informed care and traumatic brain injury and motivation and mental illness and gender-responsive treatment and all these kind of responsivity factors that are invisible sometimes to the criminal justice system. And so you have all these justice people bored out of their mind listening to another talk about R&R and getting misinformation, and then another group of people, another siloed group of people listening to what essentially equates to responsivity research. But the problem was that we weren't listening to each other's research, and we're at the exact same conference on the exact same day in the exact same hotel. We paid the exact same amount, and we're not listening to each other's research. So if we return to the cardiogenic metaphor, think about it from a client's perspective, and you have to kind of put yourself in this perspective for a second. Imagine that, maybe you're middle-aged, or maybe you have certain risk factors for having cardiogenic problems, and you decide to go see a doctor. And the doctor suggests, okay, well, I'm going to give you a treatment plan, but I also want you to go see a nutritionist. She's probably going to want you to get to work out, so you might want to go see a personal trainer, and it probably makes some sense for you to talk to a counselor. And so your doctor gives you some advice, and he says, this is what I believe that you should do to moderate your risks and needs. And to get you to that nutritionist, I need you to stop smoking right away. You're going to need to lose weight. And I'm going to give you some prescriptions for your anxiety, your blood pressure, and come back and see me again in a month. And so you feel pretty good as a client saying, okay, well, my doctor gave me a treatment plan. Next day you go see your nutritionist, and she says, yep, I agree, you need to lose weight, and we're going to do that with 1,000 calories a day or less with 3 small meals, and I'm going to give you some appetite suppressant supplements. They're going to help moderate your appetite so that you can get to that low carb, low fat, high protein, low calorie diet. I really want you to focus on calorie sparse and nutritionally dense products. And then you go see your personal trainer, and your personal trainer says, no, that's not the right plan for you. I need you to have a high calorie diet because you need to hang in the gym, and I need to get your metabolism up. If you do what your nutritionist says, your metabolism is going to go down. So I want you eating at least 5 meals a day, and I want you to take some energy boost supplements so that you perform better in the gym. And I agree, you need to stop smoking. So then you start to become frustrated because you're getting competing information from your different providers. They're all starting to tell you somewhat competitive things. So you go see your counselor, and your counselor says, well, you know, I agree you need to stop smoking, but that's not a big deal for you right now. I want you to put that out. We're going to call that a distal goal, not a proximal goal. I need you to focus on your stress and your sleep and your anxiety, and I don't want you taking any of those supplements because they're just going to aggravate your pre-existing anxiety, stress, and sleep problems. But I want you to do what your trainer says, and I want you to do what your doctor says. So as a client in that setting, you're getting competing information from different practitioners, and I believe some of that is evident in the criminal justice system of these silos between how the criminal justice system handles people who are involved with problems with substance use and how the behavioral health community does the same. So if we draw a parallel to people who are in the justice system, it looks very similar, where as a client, you're getting advice from your parole officer and they tell you certain things. You get advice from the Medicaid guy who says what's medically necessary. You get advice from your clinician who might be somewhat departing from what your parole officer says. And then your peer mentor says, well, I don't know that I would listen to all that. I would do some of these things. And as a client in that situation, you're right smack in the middle of this competition and this lack of collaboration and this lack of cohesion between Risk-Needs-Responsivity and ASAM. Next slide, please. So I'm going to show you maybe an idea, conceptually speaking, and a little bit of data about integrating these things that currently are siloed or maybe even competitive. Next slide, please. I believe that we can work to innovate Risk-Needs-Responsivity and ASAM so that they're more integrated. There might be a situation where we can't identify where one stops and the other one starts. And if we use our imagination, I think we can do that. And I'll show you some data of what that might look like. Next slide, please. In Colorado, we have a standardized treatment system that we use that's based on R&R and ASAM. And there were 2 separate recidivism studies, one from fiscal year 13, a set of clients in a community corrections program in Colorado, actually a community corrections system, another follow-up study several years later. And in our standardized treatment system, we have essentially 8 levels of treatment that look a little bit like ASAM levels of care. They're sort of modified for criminal justice language. And the level that I'm going to be talking about, well, let me back up. The 8 levels that we have in Colorado are based on this Risk-Needs-Responsivity framework, where lower risk, lower need people, lower severity clients go to level 1, and then higher risk, higher need, higher severity clients go to level 5, and then we have the different shades of gray in between that. And so it's based on a continuum of both Risk-Needs-Responsivity and ASAM considerations. Next slide, please. In the recidivism study, I'll just kind of let your eyes get oriented to the slide here. This is the first recidivism study, and if you look at the left bouncy arrow there, you'll see that this study was about 8,000 cases in about 31 different community correction sites in Colorado. And the first statistic that you see is the match rate, which means 80% of the clients in this fiscal year timeframe were matched to the level of treatment that was indicated by Risk-Needs-Responsivity and ASAM tools. If you go to the 2 bouncy arrows to the right, you'll see differences in their post-release recidivism rates at roughly 20 to 24% difference. So what this basically means, in simple terms, is that 4 out of 5 people were matched to their assessed level of treatment using both Risk-Needs-Responsivity and ASAM, and those that were matched had about a 20% lower likelihood of recidivism based on this study. We replicated this study several years later for a different cohort of clients, and this was about 13,000 clients, and you'll see the exact same patterns where you'll see for those 13,000 cases about an 80% match rate and meaningful differences in recidivism. And so while we can't generalize this to all settings and all states and those things like that, it does illuminate a potential for us to do some work in integrating these 2 concepts. Next slide, please. So what I can imagine here is that we can use the brain power of this group to do several things. I can imagine a world where we really do a deep dive into integrating the Risk-Needs-Responsivity model and the ASAM frameworks and really use some creativity to find out how we can blend those 2. I would like to see a world where we have specialized placement criteria at the federal level for justice-involved clients that honor both risk-needs-responsivity and ASAM research. I could imagine a world where federal and state agencies are aligned on treatment matching protocols for justice-involved clients. While this next bullet is in and of itself its own problem, and maybe a little bit provocative, I can imagine a world where Medicaid prioritized actuarially-based treatment placement over medical necessity, or at least that medical necessity was informed by actuarial assessments and this integrated model. And I can imagine a world where we have evidence-based and risk-informed frameworks for the right dosage of treatment for clients, the right intensity, and the right setting. You know, there's really good emerging research right now on the kind of risk-informed dosage levels that seem to work for justice-involved clients, and I think we can contribute to that research and innovate on that research. So those are my comments today, and then I think Heather is going to kind of share her perspective on this same idea.
Yeah, thanks, Glenn. So I am going to share my screen. Which for some reason it's not letting me do. So sorry about that. Let me try to move it over here.
Heather, if you keep having trouble, I have your PowerPoint too, and I'm happy to drive if that's useful.
Yeah, actually, could you? Because I'm getting some weird error. I have to reset my permissions. Yeah, that's very odd. Okay, sorry about that, Lindsay. So whenever you're ready. And I can't see you, so just let me know when it's up.
Oh, we're up, Heather.
Oh, okay, thanks. Okay, yeah, hi all, thanks so much. I'm just gonna take about 10 minutes to set up our group discussion around R&R and ASAM and how they might incorporate each other and what research questions you have related to the integration of ASAM criteria and the R&R model, as well as what research JCOIN could pursue to help advance these efforts. Next, please. So as Glenn demonstrated, there are some differences between the R&R and ASAM models. R&R assessments are focused on reducing the likelihood of rearrest, reconviction, and reincarceration, whereas ASAM is focused on reducing addiction and addictive behaviors and enhancing recovery prospects. And these goals are not necessarily the same. Next. So R&R assessments are more bureaucratic in nature. They rely on a tool's internal scoring system, typically agency policy to guide decision-making, while ASAM is clinical and relies greatly on clinical reasoning to guide scoring and decision-making. Next. I'm sorry, there's animation. After completing an R&R assessment, the user gets a recommendation of what level of control to exert over justice-involved individuals and what criminal justice risk factors to address, whereas the person completing the ASAM aims to make a decision on a person's level of care. Next. So in other words, R&R assessments identify what to address to meet its goal, whereas the ASAM identifies how to best meet its goal. Next. So for example, the R&R assessment may identify substance use as a need, whereas the ASAM identifies how to address that need. Next. And finally, in an R&R assessment, a person's substance use disorder could be a secondary concern, but it's always the primary focus with ASAM. Next. So again, it's this distinction that R&R tells us what to focus on and ASAM tells us how. that's really important to consider for our discussion. Next. So the R&R assessments measure domains related to future justice system involvement and scores them as none, low, moderate, high, or some variation of that. And then a criminal justice professional can use that information to send a person to a particular treatment or intervention. The ASAM scores domains related to substance use or co-occurring disorder problems. And it also scores these domains as none, low, moderate, or high. But then it looks at those domains in relation to each other to determine a person's level of care on a 10-point scale. So if an individual's R&R assessment indicated a need for substance use treatment, they might then be further assessed by a trained clinician using the ASAM. And this would provide more detailed information on what type of treatment they would need to best address their substance use disorder. So this is how the two sort of naturally fit together right now. So despite their differences, the ASAM and the R&R are not, I'm sorry, next. Sorry, Lindsay. Despite their differences, the ASAM and the R&R are not competitors. R&R is an indicator of how likely the person is to be justice involved and how severe their needs are. But like ASAM, criminal justice is concerned with functioning. So the higher the risk score on an R&R typically indicates that the individual is more likely to have problems with the justice system. The criminal justice field is interested in quality of life, so higher scores on the R&R assessments typically mean equate with a poor quality of life. And the criminal justice system is interested in engagement in civil society, and a higher score in an R&R could mean an individual is less likely to be a productive member of the community. Next, please. So what can the field of criminal justice learn from ASAM philosophy? So these three things in green here are really about changing our expectations. So rather than assuming that a person is ready to change or assuming that they can change, criminal justice professionals might instead have no expectation that a person is ready to change and include assessing readiness for change as part of the case plan. And the same goes for expectations about successfully completing required treatment or interventions. So by understanding the various ways in which a person might respond to treatment, the CJ field can better respond to all the different ways that people do respond to treatment. Next, please. And so these next few in orange might be a bit stickier. So rather than focusing on needs as a sort of discrete set of issues, which is what happens a lot with R&R assessments, CJ professionals might consider how all of the needs are related to each other. Also, you know, if the field is interested in changing problematic behavior, it might need to consider shifting focus from the many aims of justice to one aim, which is rehabilitation. Next, please. And then these few in red are really longer term goals. So going from group treatment to individualized treatment and planning, moving from fixed lengths of stays to flexible lengths of stays, and moving from making treatment decisions based on resource availability to making treatment decisions based on individual need. So just a few ideas there of how CJ can learn from ASAM philosophy. Next, please. So we might also think of turning the R&R model on its head. So where responsivity factors aren't thought of as being of secondary importance, but where the idea of responsivity factors is put front and center. So the ASAM placement criteria is based on a philosophy that effective treatment attends to multiple needs of the individual. So like Glenn's talking about this biopsychosocial idea. So not just their alcohol and drug use, but it addresses medical, psychological, social, vocational, legal, recovery environment problems. So it's important to think about how this philosophy might be adapted to the criminal justice world. So rather than having criminal justice professionals think of risk factors as separate needs, again, they might consider how all of the risk factors and all of the responsivity factors are impacting each other. and impacting the person's justice involvement. Next, please. So, you know, on the flip side, what might treatment providers learn from the R&R model? So right now, ASAM is currently in the process of revising its guidance related to justice-involved individuals. So I'm just going to touch on a few ideas here. So first, providers can connect justice goals with health goals in their case plans. Next. Treatment providers might also want to identify the role that plays in criminal behavior. So treating a person's substance use disorder will not necessarily impact their risk of CJ involvement. So to that end, treatment providers might want to identify a person's additional criminogenic needs. Next. And when it comes to the assessment, when the client is justice involved, treatment providers might want to focus on increased risk of suicide, traumatic brain injury, ADHD, PTSD, mood, anxiety, and personality disorders, and impulse control issues. Talking about recovery capital, certainly focusing on strengths, resources, and abilities would be really important with this group. Also, how impulsivity might impact coping skills. They might want to focus on this individual's locus of control, and also employment, education, housing, and financial issues. Next, please. So, and finally, you know, treatment providers will want to collaborate with their CJ partners to develop agreements where, you know, the CJ partners can really establish clinical steps to support recovery. And obviously, planning to partner with CJ agencies to provide medication-assisted treatment is an avenue to explore. Next, please. So where do we go from here? So those working in criminal justice might consider integrating ASAM levels of care into R&R decisions about problem severity. They might want to recognize the role that substance use disorder plays in a person's need for treatment. And they might want to recognize ASAM as a means to better address substance use disorder needs. A few ideas for those who work in the treatment field might be to recognize R&R as a framework to determine problem severity, recognize that R&R can contribute to an understanding of levels of care, and use justice involvement as a measure to understand trauma and unmet needs. So, you know, we've just presented a vision here, and I'm going to turn it over to a group discussion. And some questions for consideration are, you know, how might CJ agencies incorporate the ASAM placement criteria or the ASAM philosophy? How can treatment agencies incorporate the R&R model? And what research questions do you have related to the integration of ASAM and the R&R model? And how could JCOIN you know, really help to advance these efforts? And I'm sorry if I didn't tell you, Lindsay, we should be on the discussion question slide. And I think we can keep this up, and we'll turn it back over to Pam and Faye to facilitate the group discussion.
Well, first of all, let me thank you both, Glenn and Heather, for putting this together. I know that it's something that both of you have been working on, these ideas and concepts before this conversation or before this presentation. And the depth of your thinking regarding this is very obvious in the very succinct presentation you put together, in crystallizing a lot of really challenging questions into a brief presentation. So thank you for hitting our first target and our first goal, which was to get done in a half an hour so that we can have some good questions. There are questions in the, there is a question in the Q&A I thought we might as well just start with.
And that chat box, Pam, there's two.
Yep, but I've got a Q&A one that came up first, and that is cardiogenic risk would also include some risks related to the social determinants of health, not just individual dynamic factors. And the same is true of criminogenic risk. So how do you see realigned R&R ASAM model addressing and incorporating the social determinants of health research? Either of you or anybody, Faye, anybody.
Well, I can tell you that on a study that we are currently conducting with over 30,000 probationers in one state, we are finding that transportation, financial security, food security are some of the biggest threats to probation violations and revocations. Not the traditional thinking about, you know, criminal behavior or antisocial peers or antisocial values, none of those. So I think that this opens the door for us to do what Heather was thinking about, which is let's put our emphasis on responsivity. Let's have a better idea about how do we tailor programs and services to better meet the needs of individuals, which is what ASAM is about. And, you know, and in the responsivity area, we can add some of these issues like transportation, housing stability, food security, all of those things that the criminal justice system has typically thought aren't relevant, but there's increasing evidence that those are extremely relevant to how well people function. So I think, you know, what we've got is an opportunity here to think differently about even the social determinants of health. How do they affect people who are involved in the justice system?
And from my perspective, I 100% agree with Dr. Taxman here. I think if we're talking about opening up an idea for innovation, I think that means it's opened up for really looking systemically at some of these factors. You know, for example, in Colorado, we're starting to study some trends about women on probation, and we're starting to see some of these social determinants driving sometimes their inability to, sometimes they're in the middle of competing between compliance with supervision requirements and then taking care of their family for all the factors that Dr. Taxman mentioned. And so those are individual drivers because they are systemic. So from my perspective, if we're talking about innovating and creating and things like that, I think all things are on the table. So that's what I think about it.
Well, and I also think related to this, you know, the criminal justice system has always taken a hands off for issues that are related to health or issues related to, you know, poverty. But I think as, you know, we have grown in our realization of, particularly with some of the dialogues right now about racial justice, we're realizing the degree to which, you know, we have to work with people as a whole, and we also have to recognize the experiences that people come from and how they respond. So I think Steve Hansen had a really good question in the chat box where he, you know, related that many people believe criminals can't change. How do we get them to understand the notion of readiness versus capacity? And I don't know, Steve, if you were on the earlier discussion by David Best, but, you know, he was talking about some of the ideas about recovery capital. And I think when we start talking about that and the more humane nature of people's lives, housing stability, issues related to food security, it changes the dimension. I mean, you know, an exercise I go through in my class frequently when I'm teaching about some of these issues is basically I ask people what's their behavior like if they skip breakfast and lunch. So they're very hungry during the day. And most people will recognize that, you know, when they're hungry, they tend to make, you know, not the greatest choices, either in the foods that they eat, a lot of potato chips or anything in front of them, or, you know, in the decisions they make. And I think this is how, you know, we need to really proceed, is helping understand the social determinants of health, but also what factors affect people's behaviors. So I don't know, Steve, if you want to elaborate more in your experience in New York.
So I guess the thing that I saw in Steve's question was coming to grips with a difference in understanding regarding readiness to change and capacity to change. And the justice system that many in the justice system don't think people can change. And so I wonder if you can talk a little, is that maybe that's a responsivity question, right? And that, and flipping this upside down, instead of the focus being on risk to focusing on responsivity, and what that means in social determinants, but also what it means with regard to capacity to change.
Yeah, Pam, I don't know if you can hear me, but I agree with that in terms of the focus on how the community looks at criminal behavior and whether folks can change. You know, with discussions as late as last night about law and order and the requirements for that, and things that we've been through in terms of excessive incarceration. You know, how do we get the community to understand the notion? You know, as a counselor for way too long, I know all of the individual focus on how to get somebody to believe in themselves, but how to turn around community perspectives, particularly when you look at, like in New York, a lot of what happens in county jails is driven by what the sheriff will allow. And sheriffs are generally elected not because of their open humanistic approach to working with criminal behavior, but their focus on law and order and protecting the safety of the citizens of the county they're in. And some are very open to looking at things that can be very helpful to people. In New York, we have Sheriff Apple, who has implemented a lot of programming in his jail. And due to his jail being largely empty these days, has converted some of the space into temporary homeless shelters, de-jailing the look so that it looks a little bit more or a little less like a jail. And then there are others who are under court orders to provide the inmates with toothbrushes.
I see a conversation kind of going back and forth a little bit or between Eve and Elizabeth around responsivity, strengths-based services, and recovery capital. Eve, you want to maybe state your question or comment, and then maybe Liz can jump in and either elaborate or help clarify thinking along those regards, because I think there's an interesting connection there. And for those who are on the morning session, very interesting connection to what Dr. Best was talking about.
Sure. I was not in the morning session, so I can't take it there. It seems to me in hearing these conversations, there is enormous overlap between the ASAM dimension of recovery environment, recovery capital, the term and the notion of recovery capital, and the responsivity notion in the R&R framework. I think that was part of what I was hearing Glenn getting at in his presentation. But I think that we can talk about the overlap and similarities between those, and also social determinants of health. These are all, you know, I can see an infographic. There's an infographic in our future, people, with overlapping issues. So I think those are tremendous overlappers, and I think we can think about and talk about that as a field and fields.
And this is Liz, happy to jump in and appreciate the infographic idea, because that's kind of what's in my comment, rethinking. And I also appreciate the use of the cardiogenic example, because I think it makes it easy to make some connections to social determinants of health and public health. I think that, to me, that opportunity to rethink And the infographic does connect to some of the research around recovery capital. And I wasn't on the earlier session, but we use David Best's work a lot in the project that I'm working on. And I think a part of that, for me, the infographic is maybe thinking of it as a triangle that has R&R on one side, ASAM on the other, and recovery capital assessments and that whole framework at the bottom. Because in some respects, to subsume recovery capital as just one element of ASAM devalues its power, I think. And the notion of rethinking the purpose of the systems, if you will, that both R&R and ASAP are a part of is, I think, what the recovery capital research is suggesting that we do. And so I think there are a lot of areas for conversation. And so to me, some of the research questions related to the integration of the two is kind of a step back or a step outside of the two to, as I think Glenn said, and I appreciate that, rethink, and as Faye said, think differently about all of these pieces. So that's exciting to me.
Glenn, Heather, Faye, comments?
Well, I wanted to actually invite, if Deanna's still on, to go back to the conversation about changing community perceptions, because I think this is the value of having individuals that are impacted, who live in communities, and some of the work that Just Leadership USA and other organizations have done in terms of really trying to think about how do we change community perceptions about the issue that people who are involved in the justice system can become productive members of our community. So I don't know if Deanna's on, but I just wanted to offer that. Maybe she left. So anyway,
Faye,
I think that's a topic maybe for later.
Faye, I know there's a lot of folks waiting for questions. I just want to add a framing as we continue this conversation. You know, what does JCOIN sort of sits at this space of research, but as I stated earlier, we really do want to break down some of the silos. So as you continue on this conversation, if you can think about, you know, what would be a research priority, or what are the tools that JCOIN has at our disposal that we can bring to bear on this conversation around how do you integrate these different views and use that to drive better outcomes. So I'll turn it back over to Pam and others to figure out who goes next of all these folks that have great questions. But I just want to bring it back to that.
Next, he was our second question that popped, and so I don't want to skip him as we move forward with the rest. Go ahead, Brandon.
Yeah, hey, this is Brandon. Can everybody hear me?
Yep.
Great. No, it's so interesting to hear this. I come at this as a, you know, I'm a postdoc with Tracy Green and Jody Rich at Brown, but after coming to that after 23 years of policing, so I hear the talk, I hear a lot of the talk about justice involved meaning community corrections. And so I think one of the research questions in my mind is to what extent can we generalize these findings to police involved encounters at the front end of the justice system? Because I think, you know, people are already pretty far down the pipeline by the time they get to community corrections. And then the second sort of a question or a thought is, in my experience, when I ran a police department in Vermont, so much of the outcomes hinged on the attitudes and beliefs of the officer with discretionary power at the street level. Do I refer? Do I arrest? Do I warn? Do I use the organizational linkages at my disposal to set someone down a different path? And then I think the decisions they made were also norm setting in the community. So like, I guess my first question is, to what extent, okay, 3 questions. Is it a priority to look further upstream at these police level interventions rather than corrections as a complement? Can we generalize some of these findings already? And then to what extent do individual attitudes and beliefs at the individual level need to be sorted out as a research priority to get the better health outcomes? Thanks.
So I think, Brandon, you know, are starting to answers the call that Tisha put out about some really important research questions, right? So you're asking research questions about behaviors of police and how they can be used to improve health outcomes of people that, you know, have opioid disorders or other types of drug use behaviors. I think also thinking about how police can use the R&R plus ASAM, the new, whatever new model will come out of this. But thinking about that, I know in one project that I worked on, the police were given a risk screener, and that actually turned out to not contribute to the police better understanding the behaviors of individuals. So I think that a lot of research questions here are, you know, particularly for a lot of justice actors, you know, what is it that they need to understand about substance use disorders to really affect how they think about the use of, you know, either alternative programming or treatment initiatives. But I think you have some good ideas for us to think through.
I'm going to ask Chief Black if she's available to kind of piggyback on this discussion, because she was asking some similar questions. And I want to just, we may not have the answers in this group right now, but I think, again, to Tisha's point, it will get the questions out on the table for all of us to get our research brains and creative juices focused on. So Chief Black, if you're able.
I am, and I think there's a couple of important things to consider here. Whether it was by intent, because we educated and provided information to our officers about resources available to do pre-arrest diversion, or the other influence, the other COVID influence, is that many of those arrests did not occur as they would have before, simply because jails were not accepting people. And so behavior changed through that process as well. So the comment I made, or the question I put in the Q&A is there a good comparison between recovery rates, connection to services, to people that are justice involved versus not justice involved? And if we remove this, which I feel is definitely a movement that is occurring across the country through police reform efforts and criminal justice reform, what takes its place? And so, and finally, you know, in terms of social determinants of health, I mentioned that we have been screening people as they are released from jail. I'll be happy to share that model and that information with you, Faye and Pam and Lindsay and Tisha. But this is a larger question about what is the role of policing in a community. And we are all around this topic when it comes to responding to mental health, behavioral health, suicide, crisis kinds of things. And you can't separate that from this discussion. And so, you know, do we need police officers to respond to somebody that is hungry, or that is unsheltered, or that is injecting substance in a park? And that's the question every community has to ask. And if it's not us, because we have been for decades the one call solution, and we go and we do the best we can, and it's not always good, and it's not the best role in my mind for police officers, because we have limited tools, and particularly in communities that don't have a strong social services network that you can tap into and direct somebody there, as opposed to arresting them and hope they get it on the back end. So sorry for the long-winded response, but we're doing all the things that everybody's talking about, and pre-arrest diversion and diversion before charging, and diversion through probation and community corrections. And I still don't see things getting better. And we talk about being upstream. I want to be upstream, but right now my people are soaking wet because they're pulling people out of the water.
So, you know, Chief, that relates to some of the other sort of discussion that's happening in the chat as regards systemic responses to issues and community responses to some of these issues, and as distinct from or complementary to individual responses and individual assessments and individual treatment plans. And so I'm wondering if I think Heather commented on that a little bit in the chat, if she has some thoughts about that, or Faye, with regard to both the research questions related to that and where to look for those answers that Chief Black is asking about, which is, where's the evidence of what's effective at this point, that point in the system?
So I don't mind, I just want to jump in really quickly. I think that that is such a powerful point that Chief Black just made, and it's something that we talk a lot about internally in our research center. The biggest, I guess, the risk factor with the greatest magnitude for predicting future involvement with the justice system is criminal history. So when you talk about, is there evidence that justice system involvement inspires change, connection to recovery, I think that that's really something interesting for us to look at from a research perspective, is what is the effect of justice system involvement? We know that it's, the greatest predictor of future involvement. So what is that telling us about the impact of the justice system? So that's just something that, as you were talking, I was getting super excited because we are having these conversations in our own research center right now. So I just wanted to piggyback on that, and I appreciate that, that topic that you brought up. Thanks.
And there are both individual and systemic contributors to that, right? And which comes first, and which is more predictive, where's the greater strength, and then where's the leverage to really support change and all of that. Faye, did you have anything?
Well, I was just going to add that, from the research literature, we do know that having criminal justice involvement has a slight advantage of people completing substance abuse treatment programs. And, we've seen that trend pretty historically. But I think, it's all, a lot of it has to do with the question of whether or not people have access to those services, and then whether or not the services, address the multiple needs of individuals. And I think some of the unanswered research question, especially now as we're trying to really think about, a modified R&R, what I like to call the third generation of the R&R, or, converging R&R and ASAM, where the emphasis is on the individual, is, how we can do some of the systemic work to make improvements in the communities that people come from. I mean, this is the great dialogue right now that we're having, that has to do with, oppressed communities in our society, and whether or not, if we can address some of this oppression, that actually people can live better, more productive lives. And I think, there's a whole host of research, because we haven't wanted to open up that kind of area for discussion. But that's also something that, could affect, the question here about ASAM, R&R, and thinking about it more from a cultural lens.
Yes. And I want to tie that to a comment, and then Sis, I'm going to go to you, okay? If you had a comment, one of the questions, Faye, whether you saw the question or not in the Q&A, had to do with is in addition to behavioral health, social determinants of health, risk-need-responsivity, is there a need to use a systemic racism or race and ethnicity kind of lens and deconstruct some of what's happening and to understand how to make changes as well. And I think you addressed it, but I want to make sure that, or you touched on it, I want to make sure that we hear that question as a part of this discussion, whether we're talking about recovery capital, whether we're talking about policing, whether we're talking about change that is affected through the justice system, positive change, or negative change, right? Or negative impact. So I think all of that also has to go through a racial lens. And earlier today, we heard statistics also about a gender lens, right? And that gender has a special and unique impact on some of the outcomes that people experience as well, as do many others. I don't mean to imply I'm being all inclusive. Sis?
First of all, I want to say amen to what you just said. I think it's absolutely true. We can no longer not do that. But in reference to the risk for future criminality is previous involvement. And so I think we need to ask the question, what didn't happen that could have happened with the previous involvement, because it wasn't that serious, so we didn't take action. I really think deflection movement has a whole lot to do with that. But, and not only what we didn't do, but what natural supports does this person possibly have? Is there someone at home? Or is the whole environment needing to be addressed? So that fits into what we said earlier about family and children need to be remembered. Otherwise, we will continue to do what we have always done, is keep on getting them back. Thanks.
Thank you, Sis. I do think we're all, many of us, maybe not all, are pretty familiar with the school to prison pipeline, the child welfare to prison pipeline, and research that shows earlier interventions that support families. Research project that we've been involved in for 20 years shows that supporting families to achieve recovery and stable family reunification reduces juvenile justice system, not only child welfare involvement, but then juvenile justice system involvement. And so, to Tisha's roots, paying homage to Tisha's roots for a second in the child welfare system, we know that earlier interventions do make a difference. And so the question is when, where, how, where do we support that, et cetera. We're gonna wrap here. Faye, do you have any, I really wanna thank Heather and Glenn. You guys did a great job. You raised a lot of issues, but you also suggested solutions in raising those issues, or next steps for us as researchers and as people who are conceptualizing what the future of these systems look like. So I want to tell you how much we appreciated your presentations and the comments and questions by our participants. Faye, do you have any final?
No, I just wanted to highlight that in the chat box, and we'll produce these for people, there's some really excellent comments about some research topics related to ways in which, the systems may be unhealthy, thinking about how to improve reform within CJ and addiction services. I think that, I really want to thank everyone for, contributing to this dialogue. This has been an area that's dear to my heart for many moons. So I think, we have some great ways to begin for thinking through next steps here. And I thank everyone for their contributions.
And I'll just echo that. Thank you so much. This has been a really rich conversation, and I've really enjoyed reading through the chat and the Q&A. And yeah, this has been fabulous. So thank you to our facilitators and to our presenters and to all of you for contributing to the conversation. This has been a really great first step in this process.
Thank you. Thank you, everybody. And we are done. That's a wrap.